All right, we've had a request in the comments to discuss how to tell the difference between disruptive mood dysregulation disorder and oppositional defiant disorder in kids. Let's dive in. Hi out there. This is Dr. Brett Pearce, child psychologist, coming at you with a video that is a response to a comment request discussing two different childhood disorders. So the first one is disruptive mood dysregulation disorder, which is actually a childhood depressive disorder characterized by intense rages that occur at home and at school, well, in more than one setting. And also the kiddo's mood needs to not be great outside of the tantrum. So it's not like we're happy-go-lucky tantrum and then go back to happy-go-lucky. We're sullen, grouchy, angry, irritable, and then we also have horrible rages. Oppositional defiant disorder, on the other hand, is a problem behavior disorder, or actually technically called a disruptive behavior disorder, which is confusing because DMDD also has the word disruptive. But this is disruptive as in aggression, rule-breaking, defiance. So oppositional defiant disorder basically represents a kid who is fundamentally and primarily angry, hostile, vindictive, argumentative, conflict-oriented. And so the question is how to tell the difference. So one good thing to know is that in our current diagnostic system, you cannot actually diagnose ODD and DMDD in the same kid. And that's because they're effectively a lot like competing explanations for the same thing. So the best way to tell the difference between the two is to really ask yourself, what seems fundamental? Like, what is this kiddo's primary way of operating? So a kid with ODD is likely going to fight adults, teachers, parents, even other kids, but let's just stick with authority figures for now, is going to fight and resist just sort of because. They just have this compulsive need almost to just resist, argue, fight back, a real fundamental lack of deference to authority figures. Disruptive mood dysregulation disorder is a mood disorder, however. So it's not that kids with ODD are known for being perfectly happy, it's just that they're highly argumentative. But kids with DMDD are going to seem a lot more primarily mood disturbed and are not likely to fight adults over every tiny little thing. In fact, I've seen kids who have DMDD. I've treated quite a few of them. And very often in my office and with a lot of their day-to-day life, everything's perfectly fine. In fact, I can think of a couple of kids I've treated with DMDD who were fairly soft-spoken and, not necessarily kind of tough, argumentative kids in general, but they had horrible explosive rages when they were set off by a stressor, right? Whereas a kid with ODD is not necessarily always having a horrible tantrum, although they sometimes can, but is going to be a lot more argumentative just as kind of a de facto way of being. They might even be relatively calm, but still being highly resistant to everything just for the point of being resistant. And it really needs to be meaningful amounts of resistance. Sometimes people treat any tiny little deviation from like militant compliance as being oppositional. And with the kid with ODD, we're looking for it to go way beyond that and to really be causing a lot of problems in terms of that kid's ability to handle home life and probably school. So a couple of pitfalls just to watch out for. So commonly you'll see basically any angry, explosive kid diagnosed with ODD. But then what you do is you go, okay, well, is the kiddo really that much of a problem outside of the explosions? And if the answer is yeah, the kiddo's argumentative and defiant pretty much all the time and then has horrible tantrums, I guess you're probably talking more like ODD. But if the answer is no, the kid's really not that, much of a behavior problem outside of the tantrums, but the kid is, really angry and has got a chip on his shoulder and just never seems happy and seems to have a negative outlook on life, on others, on himself, on the future, that sounds a lot like a depressed kid or a depressed person, right? Remember, DMDD is a depressive disorder, so you're looking for all those relatively classic signs of depression. So that's just a little bit on how to tell the difference between the two. The commenter also asked, well, what would you look for in order to get your kid checked out if you're concerned about something like DMDD or ODD? So the most common referral concerns that we mental health professionals who work with kids get are things like tantrums and problem behavior, aggression, not listening. So those are common things to look for, although what's hard about those referral concerns is that could basically be any kind of psychiatric issue. You'll hear that kind of list of problem, or rather referral problems for a kid with trauma, for a kid with ADHD, for a kid with depression, for a kid with anxiety, and so forth. And so they're very legitimate, things to be concerned about. They're very legitimate reasons to seek out consultation from a mental health professional, but they're not necessarily diagnostic, if that makes sense. So you just always have to ask yourself your question, okay, how does kiddo seem to be doing? Is kiddo handling day-to-day life at home and at school? How am I doing with kiddo? Am I having to work 5 times as hard as I feel like I should in order to handle things because of kiddo's difficult feelings or behaviors or whatever that's going on? Even if you feel more like it's mostly your problem, which is a very fair and open-minded way of looking at it, it's still a very legitimate reason to get kiddo checked out, because sometimes what we end up finding out is that kiddo's really struggling with a mood problem or a problem behavior issue like ODD, and that we're just working we should work hard, but we're working just immensely, way too hard to try to manage the issue. And that's part of why it's not worse, is because we're bending over backwards to try to deal with the problem. So those are just a few ideas. Thank you so much to the commenter for requesting a video. It seems like DMDD in particular is a rather popular topic on the channel, and that suits me just fine because I enjoy discussing it, and I'm very glad that diagnosis was added into our system back in, I believe it was about 2013 when the DSM-5 was released. So at any rate, thank you. I hope this was informative. Absolutely keep those video requests coming in the comments section. I will do my best to accommodate them all. So thank you, take good care, and we'll see you in the next one. Bye-bye.